Good afternoon. My name is Roshni Alexander, and I will be sharing about my policy action plan regarding mental health policy as it relates to House Bill 1013. Displayed is the order for this presentation. So first I'll be discussing the existence of mental health in Georgia. 2, the introduction of House Bill 1013. 3, proposed policy action plan that I used to coin the term Georgia NMHI. NMHI is Nursing Mental Health Internship Program. 4, a estimated timeline. 5, stakeholder engagement. 6, budget. And 7, which is finally strategic leadership of DNP and Georgia DBDDH. First of all, mental health includes a plethora of conditions and diagnoses, and each individual experiences a range of severity when it comes to the illness. There are various therapeutic interventions that can be offered based on the condition, but the challenge is that resources are not always available to those that need it. Insurances find way to disregard mental health issues, and unfortunately providers may lack the knowledge of how to guide a patient to access the resources they need. Financial burden can contribute to mental health illness or may worsen the diagnosis, which is why accessibility and cost effectiveness of care is significant in providing for patients with mental illness. The first point I'm going to discuss is the existence of mental health in Georgia. So statistics show that Georgia ranks #1 out of all the states in the United States in prevalence of mental health illness. About 1 in 5 Georgia adults experiences some form of mental illness. And unfortunately, with this high prevalence, Georgia does a poor job supporting these individuals with almost the worst access to mental health care in all of US. This is a major concern. Existing problems include staff shortages, lack of funding, difficulty working with insurance, and lack of knowledge from providers. Therefore, Georgia was inspired to gather leaders together to bring about changes to House Bill 1013. So this slide is an intro to House Bill 1013. So in 2022, House Bill 1013 was passed and originally co-sponsored by Todd Jones and Mary Margaret Oliver. This bill was revised a few times and brought about the Mental Health Parity and Addiction Equity Act. The purpose of this bill was to increase access and affordability for mental health services for those suffering from a mental health illness. Unfortunately, staff shortages impact the experiences at various facilities, which is why there is a huge need to seek more qualified individuals to work at these facilities. And these individuals should want to work in a field of psychiatric mental health. Therefore, the proposed policy action plan is to establish a formal internship program for mental health clinical courses for nursing programs. Each mental health facility will be mandated by the state to allow nursing students to interview for a position as an intern. In return, the student would receive clinical hours at their respective nursing programs, and they would be required to attend public hearings regarding mental health issues in Georgia. A final project would involve an implementation or tool that would benefit the site that they interned at. And so this exposure can pipeline aspiring mental health professionals and increase participation in legislative matters related to mental health, because as we know, there is little participation and there is a need for more advocates for mental health in the state of Georgia. So to ensure the success of the program, students who plan to be part of the newly developed Georgia NHMI, which is Nursing Mental Health Internship Program, will be selected by the mental health facility. Each facility is mandated to provide their own quality clinical instructor, but each institution is responsible for compensating the assigned instructor. This will ensure streamlined clinical experience for all students. And students would benefit from a clinical instructor currently employed by the facility. And the final assignment by the student can potentially benefit the institution through some sort of drive or participation or assistance in a therapeutic program that can benefit the patients or the facility in general. As for the timeline, the first step is to ensure that Georgia DBHDD, which is a government institution, is fully supportive and helps to arrange sites and mandates clinical instructors to be selected by the facilities. So this organization is in charge of an estimated 5 hospitals in the state of Georgia. So with this close relationship, this would ensure or secure clinical spots for these students for the proposed action plan. Nursing schools will be responsible again for selecting qualified students or candidates to interview to be part of the nursing mental health internship cohort. And finally, the nursing institution has the responsibility to also assign a mentor from the respective nursing school just to oversee the student and the progress that they are making while in the internship program. Stakeholder engagement, so number 5. So students are the main stakeholders in this policy plan because their involvement is vital. Students need clinical hours for certain subspecialties, and especially with mental health, this is a way for requirements to be met. And facilities can benefit from the exposure to potential hires for the future. The pressure for mental health facilities to appear faultless, organized, and adhere to protocol would be common with exposure to students and with this high level of involvement from academic institutions. There is frequent mistreatment, staff shortage, and underreported situations that should come to light, and the presence of students will ensure mandates and protocols are being followed. In addition to students, as previously mentioned, support for the co-sponsors of House Bill 1013 would help, which is Todd Jones and Mary Margaret Oliver. Again, also healthcare staff that works at the mental health facilities, and clinical preceptors that are assigned to the students of the program. Budget. The ideal aspect of the program is a minimal expenditure from the government besides typical payment for a clinical instructor for the subspecialty like mental health. But again, each facility must cover the cost of training for their employee to be a clinical instructor, but each institution would have to compensate that clinical instructor hourly based on their needs or how many students need to be precepted in order to ensure streamlined communication and experience for students across the board. Again, this program does not reinvent the wheel when it comes to clinicals, but it just organizes existing resources to help benefit mental health resources in the state of Georgia and also nursing schools as well. And finally, strategic leadership of DNP and Georgia DBDDH. So the DNP role is to ensure qualified students of the program to follow procedures and protocol to ensure safety. In addition, to advocate for attendance of Senate hearings and meetings because it's very important for attendance so that other members of Senate can recognize the importance of mental health issues in the state of Georgia. It is also important to ensure mental health facilities receive quality interns that can potentially work as future healthcare professionals. And this is why it is important to work closely with the nursing schools so that mentors can serve as extra personnel to monitor the students that are part of the internship program. House Bill 1013 supports staff shortage in mental health facilities and the use of these students can be used to advocate for mental health related issues or any shortages or lack of resources that these facilities may have, because students have a very strong and influential voice. The Georgia DBDDH is responsible for efforts in Georgia related to mental health services for individuals, and they are responsible for mandating mental health facilities and provide a certain number of internship spots for nursing students. And again, this is not concrete because it just depends on the budget of the government, the availability, staffing of the mental health facilities in Georgia. And finally is a list of references.